Hey, so it's about time I do an update on getting my implant, not to be confused with implants, removed. 2 weeks ago, Friday, so today is Wednesday, and I had it removed. It'll be 2 weeks on Friday. So, day before, prep, all that kind of stuff, there wasn't any, just worrying about it, I guess. It had been over 4 years that I had it, so I was just a little bit nervous about all the scar tissue and, yeah, 4 years worth of my body growing around a foreign object. So for those of you who don't know, I had my portacath, which was an implanted IV, removed. So if you don't know about that, I did a pre-video, so if you haven't watched that one, go watch that one before, which is posted on my channel, for more information about what it was. But for those of you who have been following, or at least know if you have a port and you're wondering about what it's like to get it removed, here's your video. So I went into the hospital, my dad took me, and I've been nervous for this. I put this off for years, 2 or 3 years that I haven't been on remicade for, just for the fact that I've been terrified to get it out. The way that the doctor described it when I was getting it put in was, oh, you just go in the office and, they cut you open and rip it out, I think were his exact words about that, so it terrified me. And having Crohn's and being sick, you get used to needles, IVs, people touching you, poking you, whatever, you get used to it, but it's just being cut open, awake, really scared me. So, I was waiting, and I got there an hour early, and then got really nervous and just couldn't even eat or drink anything, so I was just in the washroom the whole time before my surgery. And then they finally called me. Nurse came over and she explained so the procedure that was going to follow with the surgeon. She's like, we'll take you and you'll get changed, and then we'll expose the area and clean it and whatever. And started bawling. Lost it, so, yeah, it all just hit me that it was happening, and I got really nervous and scared, and just all the anxiety about it came out, so I got an Ativan, and, she gave me that, and I took that right before going in, so, anyway, so I went in, and, got changed, so you just have to wear a Johnny shirt, and you don't do any of it up, and you can leave your pants on and everything, but nothing on top. You lie down on the table. The room was actually really nice, it wasn't a scary operating room, but it had, I lied down, and, it was weird, because, he had all his instruments, and, the bowls that the stuff would go in, and the knives, and everything, it was all there, so I tried not to look, but again, being sick, you get so used to all of these things that you almost just look because you're used to it, and you'd rather know. At least I do. I don't know. Do you guys do that too, or am I weird? I watch them do my blood work. I watch them put IVs in me. I almost take my IVs out myself, kind of. I'll start taking the tape off and have it ready so that they just have to pull it out. Or if they pull it out, I put stuff. Do you guys do that too? Please, people, put comments. Don't make me feel so alone, I'm doing this for nothing. I want friends out here. So, anyway, it was hard to look, but not to look at the same time, if you understand that. So then I lay down, and the nurse, they just took off the one sleeve and tucked it, and then, I think he cleaned it all up. It's kind of vague memories because I was trying not to freak out. The Ativan kind of set in. It just kind of made me feel buzzed, But other than that, like, I was still, like, wide-eyed. So they did that, they cleaned the area, and then he draped me with, like, the surgical towels, like the green ones. So along here, along there, and then covered my face to get me situated, but I asked to have my face not covered. That freaks me out more than whatever. One thing I thought they were gonna do is I thought they were gonna strap me down, like my arms down and my head down this way, like they did when I got it implanted, was that they strapped everything down. I'm like, you're not gonna strap me down? They're like, no. I'm like, well, they did last time. They're like, oh, you were a lot younger. I don't know if that was just a joke or I don't know. Were you guys strapped down? Were you strapped down for the implantation or not for after? I don't know. I have no one to talk to about this stuff. So then, whatever, the nurse pulled the towel back and she stayed at my side. Nurses are always so good to do these things. And then he went to get the local, so I looked at that needle. The needles don't really bother me anymore. So wasn't that big, like just needle, whatever. And I asked the nurse to hold my hand the whole time, and she held it like the whole time, never let go. Alright, so he started by doing a local injection. This was by far the worst part. I hate thinking about it. So he started on my right side and just inserted the needle to freeze everything. It hurt a lot. Just because he had to keep, like, putting it in, taking it out, putting it in deeper, taking it out, putting it in deeper, moving it, putting it in deeper, moving it, like, all the way around, and just deeper, and, like, because it's sutured in there, so, yeah, so he did the whole needle. I cried, I'll be honest, I cried the whole time he was doing my local, and held the nurse's hand, and cried, because it hurt, and just, I tried to focus on deep breathing, so just doing deep breaths, and concentrating on the breathing and not on what was happening. It kind of got me through. I've learned to do that. So then he waited a few minutes and then he said he would test it and see if I felt like pushing. So like tap, tap, tap like that. If you touch your skin, like you feel the pressure, but you don't feel, if I was doing this with a knife, you would feel stabbing instead of pressure, but you're just supposed to feel touching. So he tested it, and I felt stabbing, of course, just my luck. So, as you get to know me, everything always goes wrong. And then he did it again, and I'm like, ow. And he's like, stabbing? I'm like, yes, sharp. So, he's like, okay, I'll go get more freezing. It's cheap, we've got lots, no problem. And I'm like, it's a problem to me, it hurts. And that was the other thing, when I was, like, at first he's like, how are you? I was like, kind of nervous. He's like, oh, it's no big deal. Yeah, it's no big deal to you. You're not being cut open. I am. This is not an everyday thing for me. So, yeah. So we did more of the local, and it didn't hurt as much the second time because the first stuff was kind of in there. So it was more just like getting a flu shot or something more along the lines of that, more than a local, because it's not that the local needle, well, yeah, it does hurt. But it's the injection burns, like it burns, and the needle hurts, and it's jabbed in there. So that's the worst part, and it doesn't last very long. It was probably felt like a long time, but it was probably 2 minutes, maybe. I don't know. So then he waited for that, tested it, and then I didn't feel sharp anymore. I just felt pressure, cut it open. After that, it was really just him for an hour, well, 50 minutes. It was supposed to take 20 to 30 minutes, but like I thought, there would be complications due to just how long I've had it in there. So, it took 50 minutes for him to cut. He said that, like, what it looked like to him, because I asked, was, my explanation is like a bacon-wrapped scallop, if you guys eat that kind of stuff. Like, he said, like, my port was purple, which I totally forgot about. The nurse was like, is it purple? And I'm like, oh yeah, it is purple. So the port's like that big, and then all the way around it, the whole thing, it was a layer of tissue of my skin that grew over the port. So I asked him, are you going to burn it off or are you just going to cut it? And he said, I'm just going to cut it. So he had to cut for 15 minutes, and all I could hear in my ears, like scissors cutting for 50 minutes of him cutting my tissue, my skin off my port. Ugh, and they just make small talk, and I just close my eyes and talk to them, and it's like, I just want this to finish. Let's just wrap this up. So cutting to the point of him being like, oh my gosh. I'm like, is it gonna come out? And he's like, yeah, it's gonna come out. It's just gonna take more time. So fast forward, cutting for 50 minutes. It finally came out after a while. Oh, and he had to so I still always try to play with my the tubes that went in this vein. He didn't have to cut this again, so that'll disappear. Probably can't even see it in this lighting, but I don't know. My scar where the catheter went into my vein, into my jugular, he cut that and pulled that out, and I was really scared that I was going to feel like something being pulled out of there, but it wasn't really that bad. It took like 2 seconds and it came out. It didn't hurt. It wasn't really that weird. So that came out and it was like a big and then when he finally had the port ready, he said he only had to cut a few millimeters bigger than my initial scar, and once it was ready, it finally came out. After that, I asked to see it so I could say goodbye, and it went in a thing to discard of it. And no, I didn't ask to take it home or keep it forever, but it's gone now. And say goodbye to that, and then he had to stitch me up. Try not to forget anything. Stitched me up. And he does underneath stitches, so they're not on the top and they just dissolve, so I don't have to go back or anything like that to get them. Whatever, the only thing I have to be really careful of is an infection, because I've heard that, I don't really have anyone to talk to about this, but I've heard from one person with someone that they knew had this done, that infection is really bad, and then all the growth or regrowth can make its way out. It'll eventually make its way out, and it just gets really pussy and gross. So I'm trying really hard not for that to happen. But they put the steri strips on it, and then a big bandage for one day. You have a big bandage over it, and then after the day, you take that off. Oh, once you can take that off, it's so much better. It needs to breathe. It's just so itchy. So I took that off the next day, and then you leave your steri strips on for 10 days, which is a long time. For me, I just wanted it to breathe, and it's so itchy. Oh, it just itches all the time. I took Tylenol and ibuprofen together for 2 days, every 4 hours or so, to help with the pain. Sorry, my boys interrupted me, I don't remember. I think I was talking about the steri strips and the itchiness. So leave the strips on for 10 days. You can shower, dab, don't rub, no baths. You can't immerse the wound or the incision in water. I took pain meds for 2 days, Tylenol and Advil, to help with the swelling and the pain, and that's it. After that, I just kind of dealt with the pain. It's not that painful. I bruised a little bit for probably 9 or 10 days, because I would switch the steri strips out twice, I think I did, just with showering. Oh, showering's the worst. FYI, I think I only showered 3 times in 10 days, because it opens the wound and it's wet and has to dry again and come back together, and it's the worst feeling in the world. Yeah, it sucked. So I would switch out the steri strips so they're clean for work and to keep it clean. I really don't want to get an infection with this. So now I'm past 10 days, so I do not wear steri strips anymore, and I'm letting it breathe and letting it heal. I don't know if I'll get bio oil or those scar reducer creams or anything. I didn't the first time, and I was really pleased with the way mine healed, so I guess we'll see how this one goes. And I'm not ashamed of my scars or anything like that, so if people ask, then whatever. So other than that, that's about it. If you have any questions, or if you're getting something removed, or if you've had one removed and you have different stories or similar stories, tell me, because I have no one to talk to about this stuff. That's why I'm making these silly videos. I don't even know if anyone cares or anyone's watching, or like, so I'd love to hear from some of you. Get the ball rolling. I don't know if you can hear my baby singing. So I'll go ahead and show you my scar at almost 2 weeks. If I knew how to insert pictures like some fancy YouTubers do, I would do that. Maybe I'll get there someday. Other than that, right now you're just going to see a 2-week-old, almost 2-week-old incision. It's not bloody or anything, so don't be scared. And other than that, my follow-up appointment is on Friday, so it's in 2 days. I had 1 week off from the hospitals, back at it again this week. And I guess me and my doctor are going to figure out an action plan for dealing with my narrowing, my slight obstruction, and my inflammation. So, yeah, the big hurdles of pain are done now. I just had to figure out a long term, because we want another baby, and I want to be healthy, and all that kind of stuff in there for my family, and being able to work, and all these things that we battle. I've been reading a lot of the posts on some of the Crohn's Facebook pages, and it's nice not to feel so alone, so I'd love for you guys to start getting involved, and commenting, and having support. So, okay, I'll show you this. So there's the scar. It's 2 weeks old. And on the end here, I think, is where he had to cut longer because it's healing differently. This is weird to film. And it just feels weird. Like, the skin is hard. And my vein that the catheter was in feels bigger. Like, I don't have that over there. Like, I can still feel that. It's weird. There. And then all the skin underneath is really hard because it's all scar tissue. So far, it's all closed. Nothing's coming out. It's pink, it's healing. It doesn't really hurt that bad anymore. It just feels weird. Alright, I don't know how these videos always end up to be so long when I feel like I have nothing to say, and then it's like, oh my god, I don't even know if YouTube's gonna let me upload this. Alright, well, that's it. So like I said, subscribe, watch my videos that you haven't watched before, leave comments and stuff, and then I'll do another update this weekend with how my appointment went, and I'll try to start making videos of answering the questions in the comments from my first horrible video. You guys who watch me, thank you, because I am not, I don't know. Anyway, I'm a dork, so I will catch you guys later, and I hope you're all healthy and happy, and if you're battling something, then let's be strong together. Send you hugs and my thoughts, and I hope to hear from you. Bye.